Videoing.
Hi, my name is Emily. I'm a registered nursing student at Northwestern State University. Is it okay if I come in and I perform a physical assessment?
Yeah.
Thank you. Vital signs have been obtained. I've provided the patient privacy. Can I go ahead and get you to verify your full name and date of birth?
Sarah Mara, 110305.
Perfect, thank you. I'm gonna go ahead and raise the bed. Can you tell me what brought you into the hospital today?
Wrist pain.
Wrist pain? Okay. Now, is that affecting your sleep or your appetite?
No.
No? Okay. Perfect. Now, can you tell me today's date?
21st.
Alright, and can you tell me who's the president?
Trump.
Do you know where you're at?
The hospital.
Okay, perfect. My patient is alert, awake, and oriented ×4. Now, you said you're having pain in your wrist.
Yes.
How long ago did this start?
2 days ago.
Do you know how it started?
I was carrying something heavy.
Okay. Does the pain come and go?
Yeah, it comes in.
Does it radiate?
No.
If you had to describe this pain, how would you describe it?
Probably throbbing.
Or throbbing? Okay. Are you doing anything at home to treat it?
No.
No. Okay. Is there anything that aggravates it, makes it worse?
Just using it.
Okay. If you had to rate this pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain, how would you rate it?
A 3.
A 3? Okay. Well, I'm going to continue my assessment, and afterwards we can talk about how we can manage that. Okay. The first thing I'm going to do is I'm going to assess your eyes. Can you tell how many fingers I'm holding up?
2.
Okay. Now, can you look straight ahead at the wall? Now, my pen. Perfect. Now, keep staring at the wall. I'm just going to shine this light in your eyes. Pupils are equal, round, and reactive to light and accommodation. Now I'm going to perform the 6 cardinal fields of gaze. You can just look at my pen and follow it while keeping your head still. Perfect. Okay. The next thing I'm going to do is I'm going to assess your cranial nerves. So can I get you to open up? Mucous membranes are pink and moist, lips are pink and smooth, no lesions, full dentation, the uvula rises, the uvula moves up, the soft palate rises symmetrically, and the gag reflex is intact. Okay, just stick your tongue out, move it side to side. Okay, no lateral deviation. Can I get you to raise your eyebrows, smile, puff out your cheeks, clench your teeth? Any pain there? Okay, perfect. Now I'm going to put my hand on the side of your face. I just want you to push against it. Perfect. Other side. Now I'm going to do your shoulders. Good. Okay. Have you had any trouble hearing me throughout this? Okay. Do you have any difficulty swallowing? Okay, good. Now I'm going to go ahead and move on to your lungs. I'm just going to sit you up a little bit. Just by inspecting, the chest rises and falls symmetrically, the breaths are even and unlabored. Patient appears to be in no signs of respiratory distress. I'm going to assess anteriorly first. If you could just breathe out your mouth. If you can pull your legs this way so I can do your posterior side, and give yourself a big hug and tuck your chin to your chest. Okay, now if you put your hands over your heads, I'm gonna listen laterally. Okay, perfect. You can sit back now. Now I'm going to take a listen to your heart. I'm going to start on the right side, listening to the aortic valve at the second intercostal space. move on to the left side, the pulmonic valve at the second intercostal space. I'm gonna move on to the Erb's point on the left side, third intercostal space. Left side, tricuspid valve at the fourth intercostal space. The mitral valve at the fifth intercostal space on the left side. Okay, S1 and S2 are heard distinctly. The rhythm is regular. Okay, now I'm gonna go ahead and sit you back so I can assess your abdomen. Just by inspecting, the shape is flat. Abdomen doesn't appear to be distended. Can you go ahead and take your chin to your chest? Okay, no sign of hernia. First thing I'm going to do is I'm going to auscultate. Take a listen. I'm going to start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are active. The next thing I'm going to do is I'm going to percuss. I'm going to start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, now I'm going to go ahead and palpate. Are you having any tenderness in your abdomen? Okay. I'm going to start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No nodes, no masses, no firmness felt in the abdomen. Abdomen is soft. Now I'm going to go ahead and roll you towards me so I can check the back side of you. Okay. I'm checking the head, the scapula, the coccyx, and the heels for any pressure injuries or other apparent wounds. None are seen. Okay. Now I'm going to sit you up. Can you tell me if you're having any problems with urination or bowel movements? When was your last bowel movement?
Yesterday.
Good. Okay. Now I'm going to check your periphery and your skin. So first I'm going to check for temperature. Okay. Now I'm going to check for edema. No edema felt. I'm going to check skin turgor by pinching the skin. Okay. Now I'm going to check your cap refill. Okay. Cap refill is less than 2 to 3 seconds. Now I'm going to check your radial pulse on both sides. Okay, your pulse is 60 beats per minute, your strength is a +2, your rhythm is regular, and they are bilaterally equal. Now I'm going to move down to your lower extremities. I'm going to check for temperature. I'm going to check for edema. I'm going to check cap refill. Cap refill is less than 2 to 3 seconds. I'm going to check your pedal pulse. Pedal pulse is 60 beats per minute, +2 strength, rhythm is regular, and they are bilaterally equal. Now, while I'm down here, I'm going to go ahead and get you to, I'm going to check your dorsal flexion. So I'm going to have you push against me. Okay, the strength is regular and they're bilaterally equal. Now I'm going to get you to push against my hands. Okay, now checking your plantar flexion. The strength is regular and they're bilaterally equal. Now I'm going to get you to grab my fingers. Okay, grip strength is regular and they're bilaterally equal. Just assessing your moisture, it is appropriate, and your color is appropriate for ethnicity. I'm going to go ahead and lower your bed. Okay. Now, are you in any pain? Okay. Do you need to go to the restroom?
No.
Okay. Is this position comfortable?
Yeah.
Okay. I'm going to go ahead and assess for any lines, any IVs, any dressings, any tubes or drains that need to be changed or adjusted. None are seen. The bed is at the lowest position. Side rails are up ×2. I'm going to move the call bell for the patient. I'm going to go ahead and put the bedside table adjusted to the patient.